So hi guys, I want to introduce you today to two procedures that I call the master procedures, and let me give you a little preface or a preamble that these are going to sound a little new agey or kind of woo-woo, but these really are procedures that are well studied, they work well, and they will help you be a better clinician and a better proceduralist. So the first one I want to talk about is visualization. So let's say you just learned a brand new procedure. First time you've been through it. You remember the steps pretty well, but ask yourself, when is the next time I'm going to do that procedure? It could be years in the case of something like cricothyroidotomy, maybe weeks or months in the case of an endotracheal intubation or central line. So in that case, there is a way you can practice that procedure without a lab, without a cadaver, without a mannequin, and without a live patient. And that is by visualizing the procedure. And the way you want to do this is as soon as you can after you've learned the procedure and gone through the steps, you want to find a quiet place, relax, close your eyes, and make yourself mentally rehearse step by step, very slowly at first, the steps in the procedure. And as you do this more often, you can sort of speed the film up, if you will, and you'll see the procedure in your head a little faster and a little faster until you're getting yourself kind of up to procedure speed, with the caveat that I tell people all the time. This is a Scott Weingart and Rich Levitan quote: slow is smooth and smooth is fast.
Slow is smooth
and smooth is fast. So if you kind of slow down to the speed of your pulse and do the procedure in slower steps, both in your head and in real life, you'll have more success. So that's the first thing. Learning to visualize procedures after you learn them, and do visualize practice again and again in your head at regular intervals, so that when the time comes, you can do it. And this has again been studied many times in basketball, in a lot of sports, in all kinds of events. Great athletes and great performers use visualization all the time. Okay, the second procedure I want to talk about is how to control your adrenaline during a real-life crisis situation. And this has been termed tactical breathing or regulation breathing. But the idea here is you're going to control your breathing pattern for 3 or 4 breaths before you begin the procedure. And then at any time that you feel your pulse racing, or you're breathing fast, or you feel yourself getting a little out of control. It's a very simple process. Again, this is used all the time. The special ops community has adopted it pretty regularly. Police officers use it. A lot of high performers use this before they go into a stressful circumstance. So it's very simple. The first thing we're going to do is we're going to take a deep breath, a deep belly breath, to a 4 count. So we're going to go. Okay, then after we've taken our deep belly breath to a 4 count, we're going to stop and we're going to hold that full breath for a 4 count. So we hold for a 4 count. 1, 2, 3, 4. Then you're going to exhale to a 4 count, and you're going to hold empty to a 4 count. And you're going to do that 3 or 4 times before you start. So let's do 1. Here we go. Okay, in. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Exhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4. And that's 1. It'll take 3 or 4 for you to really feel the difference in your heart rate and your breathing pattern. So I hope these things have been helpful to you, and I hope that you'll adopt them in your practice as you go about learning procedures and getting through stressful situations. I'm Brent King from the University of Maryland School of Medicine, and that's Master Procedures.